Let me ask you something. Did you know your nails, your hands, your belly, even your breath can quietly reveal how sick your liver really is? Liver disease doesn't usually announce itself with pain. No sharp warning, no obvious alarm. In fact, I see patients every single week who are shocked to learn they have advanced liver disease, simply because they felt mostly fine. Today, I'm going to walk you through 12 warning signs of liver disease that your body may already be showing you. Some are subtle, some are visual, and a few can be life-threatening if ignored. Let's start with the hands, because the liver leaves clues there first. Take a look at your fingernails. They grow continuously through an energy-intensive process, which means systemic disease often shows up here early. One sign is horizontal white lines across the nail, known as Mueck's lines. These lines are not part of the nail itself. They sit underneath it. If you press on the nail, they temporarily disappear. And unlike normal nail ridges, they do not move as the nail grows. This usually points to low albumin levels, a protein made by the liver. Another related sign is Terry's nails. Normally, your nails are light pink because tiny blood vessels shine through the tissue beneath. In liver disease, that tissue changes. The blood vessels become harder to see. The result? Pale, washed-out nails with very little pink. A quick test: look for the white half-moon at the base of your nail, called the lunula. If it's present, Terry's nails are less likely. Here's a simple test you can do right now. Press the tips of 2 fingers together, nail to nail. Normally, you should see a small diamond-shaped gap between them. If that space is gone, and the nails appear thick, curved, and bulbous, this is called clubbing. Clubbing is caused by excess connective tissue growth between the nail and bone. It can be genetic, but when I see it clinically, I immediately think about heart disease, lung disease, and chronic liver disease. Now, let's talk about the abdomen. Sometimes patients look pregnant, but they're not. What you're seeing is ascites, or fluid buildup inside the abdominal cavity. In advanced liver disease, the liver becomes scarred and stiff. Blood struggles to pass through it. This increases pressure in the portal vein, the main vessel bringing blood from your intestines to the liver. Think of pinching a garden hose. Pressure builds upstream. That pressure forces fluid out of blood vessels and into the abdomen. In severe cases, the belly can hold 10 to 15 liters of fluid. This isn't just uncomfortable, it can press on the lungs and cause serious breathing problems. In the hospital, we sometimes drain this fluid using a procedure called paracentesis, and patients often feel immediate relief. Portal hypertension doesn't stop at fluid. When blood can't pass through the liver, it finds alternate routes back to the heart. These smaller veins were never designed for that kind of flow. Around the belly button, veins can become enlarged, twisted, and highly visible, forming what's called capote medusae, or Medusa's head. Similar changes happen internally, especially in the esophagus. These esophageal varices are fragile and prone to massive bleeding. One of the most dangerous complications of liver disease, take a look at your palms. Redness concentrated over the fleshy areas near the pinky finger, sparing the center, is called palmar erythema. You may also notice tiny red blood vessels that look like spider webs on the skin. Press on them, and they briefly disappear. These are spider angiomas. 1 or 2 can be normal, but 3 or more, especially if you're not pregnant, raises concern. The reason? Estrogen buildup. The liver normally breaks down estrogen. When it can't, estrogen accumulates, causing blood vessels to dilate. Liver disease doesn't just affect blood flow, it affects nutrition. The liver stores energy, builds protein, and regulates metabolism. When it fails, the body turns to muscle for fuel. You may notice muscle loss in the temples, hands, or shoulders, even if your weight hasn't changed. This is a major predictor of poor outcomes in liver disease. Now, place your hand flat on a table. If one or more fingers, especially the ring or pinky, can't fully straighten, this may be Dupuytren's contracture. Over time, connective tissue in the palm thickens and shortens. While genetics play a role, this condition is strongly associated with chronic alcohol use and liver disease. Hold your arms straight out, extend your wrists and fingers. Easy, right? In liver disease, some patients develop a jerking, flapping motion called asterixis. This is a sign of hepatic encephalopathy, brain dysfunction caused by toxin buildup. One major toxin is ammonia, produced when gut bacteria break down protein. A healthy liver removes it. A failing liver can't. As ammonia rises, brain function declines, sometimes dramatically. There's a smell I'll never forget from my hospital training, a sweet, musty, unpleasant odor on a patient's breath. It's called feta hepaticus, literally the stench of the liver. It happens when toxic sulfur compounds build up in the blood and are exhaled through the lungs. This often signals severe liver failure. The liver clears bilirubin, a yellow pigment, from broken red blood cells. When it can't, bilirubin builds up. The skin and eyes turn yellow. Urine becomes dark, sometimes tear-colored. This is jaundice, and it should never be ignored. If you bruise easily or bleed longer than usual, your liver may be involved. The liver makes clotting factors, proteins needed to stop bleeding. It also produces a hormone that tells the bone marrow to make platelets. In liver disease, both processes fail. The spleen may also enlarge and trap platelets, making bleeding even worse. Here's the hard truth. There is no cure for advanced liver disease other than transplantation. That's why prevention matters so much. The most common preventable causes include alcohol, fatty liver disease, obesity and metabolic syndrome, and certain medications and toxins. The liver is resilient, but not invincible. If you recognized even one or two of these signs, don't panic, but don't ignore them. Get evaluated, get labs, protect your liver before it's too late. If you found this helpful, consider subscribing for more science-based explanations that help you understand your body before symptoms become emergencies. Your liver may be quiet, but it's always speaking. Listen carefully.